Okay, Tzvika, welcome. I'm going to ask some questions about the course. We've lost count, but you're in Belgium for the umpteenth time for the TMG course, of course. How do you feel about teaching TMG to a new group of physios?
Well, it's always a real pleasure to come here with the Smart Education and to meet the local physios. I think it's been more than 10 times, I think, now for TMD course. And every time the group is interesting for me because they bring some new background, some new experiences. And I can see that from one course to the other, the knowledge about the masticatory system and the state of mind, they're much more minded to that region. So it's not strange for them. Many of them have took some courses before or learned something about it. Maybe 3 years ago, it was not the case. It was like a very unique region for physios, and now it becomes more and more part of the mainstream of physiotherapy. So I'm happy for that. I can recognize that, and I'm happy for that in Belgium.
Yeah, okay. And besides this course, we are organizing a brand new course in September, 20 in TMD. Can you tell us more about this course, what to expect?
Well, this course will be a clinically based course, a clinical based course, where we will present specific case studies. We will let participants to consolidate their knowledge in small groups, to use the clinical reasoning process. And we will guide them, during the instructor, if it be me and my assistants, will guide them through that clinical reasoning process on the real cases, by the way, or on a real more complicated cases. And then the solution for the case study will be using specific techniques that are based on previous techniques they learned, but with some more clinical points, some more deviations, some more requires more experience, things that are in a higher level of clinical expertise.
Yeah. Okay, so we're talking about an advanced course. For who will this course be?
So the course is for participants or physios that have taken a basic temporomandibular disorders course, not only this course, but also other courses, already working in the field of temporomandibular disorder and or fascial pain, and have some clinical experience, because the cases will be not the classical beginners cases, but more advanced cases. And you need to have some experience to differentiate the more complicated cases from the more simple cases.
Okay. Well, we believe it's important to incorporate sufficient practice in our courses, but what practical and therapeutical skills can be expected in this course?
Of course, it will be focused on clinical reasoning, but like in the physiotherapy profession, after thinking about thoroughly about the case, you need to deliver an intervention. And in most cases, the intervention will be a combination of manual and exercise therapy. So the practical part of it will be actually the solution, how to solve the clinical problem with our hands and with prescribing the right exercise. So that will be the practical part of the course, which will be maybe not the majority of the course, but it will be close to half of it.
Okay. Well, last question. In October, there will be an extra course day in the masterclass dry needling. You have already taught us this course for smart education. Can you briefly outline what the headlines will be in this course?
Well, the dry needling for orofacial pain and headache is, I think, the best intervention to change the pain of the patient in the short term. That's the quickest way. It's also very safe. It's well tolerated by orofacial pain and headache patients. And I always explain participants in the courses that we have two roles when we manage patients with temporomandibular disorders and headaches. First of all is to change their pain in the short term and secondly is to recognize their contributing factor and to change it in the long term. So this course will be focused on the first part, how to change and recognize the pain source of the patient and change it as quick as possible in order to enable the patient to exercise and do the other interventory parts with less pain.
Okay, thank you for this interview, and good luck in your second part of this course.
Thank you very much. Thanks.